By age 50, you're probably 70% likely to outlive your retirement savings. As a healthcare professional, it's no secret that our education and training come with a hefty price tag, but did you know that the average student debt load for medical school graduates is over $200,000? But here's the alarming reality. By the time you retire, you'll likely have spent at least 30 years in high-stress, high-compensation careers, yet still struggle to make ends meet in retirement. In fact, a study found that nearly 70% of physicians will outlive their retirement savings. The consequences of a late start are severe, and student loan forgiveness programs, although well-intentioned, can further exacerbate the issue by pushing you into a higher tax bracket and reducing valuable deductions, jeopardizing your retirement security. When considering student loan forgiveness programs, many healthcare professionals overlook the potential impact on their retirement savings. One such program is HRSA, which provides loan forgiveness to healthcare workers serving in underserved areas. While this may seem like a dream come true, the reality is far more complex. Under HRSA, forgiven loans are not considered taxable income, which may seem like a benefit, but it actually masks a far more significant issue. The IRS considers these forgiven loans as taxable income, which can have a devastating effect on your tax bracket. For every dollar forgiven, you could potentially see a significant increase in your taxable income, often resulting in a higher tax bracket. This, in turn, can lead to a substantial loss of deductions, including charitable donations and mortgage interest. For instance, let's say you have a $200,000 mortgage, and you're donating $10,000 to charity each year. A sudden increase in taxable income could reduce your deductions by up to $5,000, which can have a substantial impact on your bottom line. To avoid this hidden tax trap, it's essential to carefully consider the implications of student loan forgiveness programs on your retirement savings and tax position. As a healthcare professional, maximizing your retirement income is crucial for achieving financial security. One strategy to optimize your income is by contributing to a traditional IRA. This type of account allows you to deduct contributions from your taxable income, reducing your tax liability and increasing your take-home pay. By contributing to a traditional IRA, you can potentially save thousands of dollars in taxes each year. Another strategy for maximizing retirement income is investing in tax-efficient index funds. Two popular options are VTSAX and VBTLX from Vanguard. VTSAX tracks the S&P 500 and VBTLX tracks the Barclays Aggregate Bond Index, providing broad diversification and low fees. By investing in these funds, you can reduce your tax burden and increase your retirement savings. Consider allocating a percentage of your portfolio to tax-efficient investments, such as index funds, and a percentage to tax-advantaged accounts like a traditional IRA. To illustrate the power of tax-efficient investing, let's consider an example. Assume an annual salary of $200,000 and a 30% tax bracket. By contributing 10% of your income to a traditional IRA and investing in a tax-efficient index fund, you could potentially save $6,000 in taxes each year. Over 20 years, this could add up to $120,000 in tax savings. This is just one example of how maximizing retirement income through tax-efficient investing and tax-advantaged accounts can have a significant impact on your long-term financial security. When it comes to managing risk in a retirement portfolio, one popular strategy is the 90/10 VTSAX/VBTLX split. This involves allocating 90% of your portfolio to a broad stock market index fund like VTSAX, which tracks the overall U.S. market, and 10% to a long-term bond index fund like VBTLX, which provides stable returns during downturns. The pros of this approach include low fees and a diversified portfolio that can help ride out market fluctuations. However, one potential con is that it may not provide enough growth to keep pace with inflation, especially in a low-interest rate environment. To rebalance this portfolio, you could consider adjusting the allocation based on your retirement goals and risk tolerance. For example, if you're near retirement, you may want to shift your allocation to more conservative options like VBTLX to minimize potential losses. Conversely, if you have a longer time horizon, you could consider increasing your allocation to VTSAX to maximize growth potential. By regularly reviewing and adjusting your portfolio, you can ensure that your 90/10 VTSAX/VBTLX allocation remains aligned with your changing needs and goals in retirement. If you're behind on your retirement savings, don't lose hope. Revisiting your goals and exploring available resources can make a significant difference. Consider consulting with a financial advisor or using retirement planning tools like the Social Security Administration's Retirement Estimator to reassess your needs. Take control of your retirement future today and create a plan to get back on track.